Yeah, so we're going to be discussing and reviewing the literature on clonal hematopoiesis. And sort of over the last 10 years, it's become clear that somatic tissues acquire mutations during aging, and this happens in the blood system as well, and it's what we call clonal hematopoiesis. So these are sort of expanded, somatically mutated clones, and they carry a lot of the same mutations you see in blood cancers like leukemia or myelodysplasia or even other leukemias, and they predispose patients to increased risk of developing those leukemias. And they also predispose patients to a number of other inflammatory conditions, things like coronary heart disease, stroke, COPD, rheumatoid conditions. And that's because those mutant blood cells are actually abnormal, and they're abnormal in terms of how they signal and sort of respond to inflammatory infectious stimuli. And the clonal hematopoiesis is more common as we age, and of course multiple myeloma is also more common as we age, and so we fairly frequently find patients who have multiple myeloma or smoldering myeloma or MGUS and also have clonal hematopoiesis. And so a big question over the last few years is whether or not there's an interaction, and how does clonal hematopoiesis impact the outcomes for patients with multiple myeloma. And I think it's not a fully answered question yet. I think one thing we can say is that there probably are some adverse outcomes to having clonal hematopoiesis, but how that really should impact our approach to treatment, our approach to diagnosis is still not totally clear. And so in our meeting, we're going to be discussing some of that data and trying to sort of figure out what the next steps are in terms of research and clinical management.